Lydia Hall, born in 1906, died of heart disease in 1969. She was remembered by her colleagues for her passion for nursing, her flamboyant personality, and the excitement she generated. She was a force for change. She believed the public can benefit from professional nursing care. A 1927 graduate of the York Hospital School of Nursing in Pennsylvania, she held various nursing positions during the early years of her career. She earned a Bachelor's of Science degree in 1937 and a Master of Arts degree in 1942. She worked with the Visiting Nurse Service of New York from 1941 to 1947 and was a member of the nursing faculty at Fordham Hospital School of Nursing and Teachers College. She was also involved in research for U.S. Health Service. Her most significant contribution to nursing practice was the model she designed and put into place in the Loeb Center for Nursing and Rehabilitation at Montefiore Medical Center in New York. Hall felt the lack of principle in nursing, which any professions must have an exclusive area of expertise. At that time, existing traditional convalescent homes fell into disfavor. Hall and the director of the rehab center, Dr. Cherkasky, convinced the board of the Loeb Home to fund the Loeb Center for Nursing and Rehabilitation for the delivery of quality service based on a long-standing professional relationship. Lydia Hall's theory was honed over a period covered the latter half of the 1950s and the early 1960s. Hall believed that the nursing is most crucial after the patient acute crisis has stabilized, when nurses should nurture and educate the patient and assist him or her in making changes that will prevent a repeat of the original crisis. She viewed that the study and practice of medicine focus on the diagnosis and treatment of disease. Nursing focuses on the human response in illness and its treatment, yet medicine and nursing overlap at many points. Nurse scientists vary in their philosophical positions, but themes common to the profession include the concepts of holism, quality of life, and the relativity of truth based on each individual's perception. Lydia Hall conceptualized the patient as a person, the body, and the disease. These aspects are envisioned as overlapping dynamic, interactive circles. The circles overlap and change in size as the patient progresses through a medical crisis to the rehabilitation phase of the illness. The care. Nursing is required when people are not able to undertake intimate bodily care activities such as bathing, feeding, toileting, positioning, moving, dressing, undressing, and maintaining healthful environment themselves. Hall identified this aspect of care knowledge in the natural and biological sciences as foundation to practice. This is the foundation of comforting and then nurturing patient to learn self-care. The cure. This aspect of nursing is shared with medicine. This might be viewed as a nurse assisting the doctor by assuming medical tasks or function. The other view of this aspect is a nurse helping the patient through him or her medical, surgical, and rehabilitation care in the role of comforter and nurturer. Hall was alarmed that the nursing profession was taking up more and more medical aspects of care, that nurturing aspect of nursing care is less focused. Seeing the patient through his or her medical care without giving up the nurturing is important nursing function for patient's growth and rehabilitation. The core. This area is shared with all of other professions that are helping the patient. The social, emotional, spiritual, intellectual needs of the patient in relation to the family, institution, community, and the world are involved in this. This involves the patient exploring who he is, where he wants to go, and will take or refuse help in getting there. Hall believed that through this process, the patient would emerge as a whole person. This interpersonal process is to help patients understand themselves for problem solving. Hall also stated the importance of nurses knowing themselves to interact effectively with patients. Turley states that through the professional nursing process, the patient has the opportunity for making the illness a learning experience from which he may emerge even healthier than before his illness. Smyrna offers example of Hall's theory into practice, as patient with pressure ulcer often loses privacy and dignity. Involving patient in decision-making is important for patient-centered holistic care to fulfill emotional, spiritual, and intellectual needs. We can find some research that Hall's care, core, and cure theory was applied in nursing practice. I'll end with a question. How would you use this theory in your practice? Thank you very much.